Hi, I'm Clark Ramsey. I'm not a doctor, but the person in studio with me today is Dr. Ross Ramsey. Thanks for being here today.
Hi, thanks for having me.
So it goes without saying that we've been going through a very unique scenario here with COVID-19. But what I want to talk to you today about are all the frequently asked questions, the questions we have that we might not be able to find the answers for, we're confused about, or we're tired of going through all the Google searches to find. So let's start here. What are the symptoms you're seeing lately of COVID-19? It seems to have changed from the when we started this in March to where we are today.
Back in March, when people were not wearing masks, were not socially distancing, not paying attention to different symptoms they may have been having, people were having much more significant symptoms of fever, shortness of breath, and cough. Very severe symptoms at that time, which some people are still having now. However, nowadays we are seeing more people with more minor symptoms. Many people are having sometimes cough, but also headache, fatigue, not feeling well, often diarrhea also. Oftentimes it just appears like they have a little bit of a viral type illness, which is what it is, but less severe than back in March. We are seeing a lot of people not having any taste or smell. What we do know is there's a significant amount of inflammation that occurs in the body with COVID-19, and as a result, it damages the nerves in our nose and mouth, causing us to lose some taste and smell. This will come back eventually, but takes time for those nerves to regrow.
So lately I've been seeing a lot on social media about incubation periods. What exactly is that? What does it mean? And how does that affect our quarantining or isolating ourselves from others?
It can be very confusing, yet let me try my best to simplify things. Incubation periods is the amount of time that it takes for a virus to grow inside someone for them to develop symptoms. They may be near someone that has the virus and spreads it to them, and then they end up having the incubation period of several days while the virus starts to develop in their body. While developing in their body, they start to develop some symptoms slowly. These incubation periods can make it tough for us to prevent the spread of the disease if we're not always taking precautions. That incubation period can last anywhere from 1 to 14 days, which is why we have a 14-day quarantine period.
And what's the importance of sticking to the 14 days of quarantining? What if I'm on day 10, I'm feeling fine, I have no symptoms? Is it important to finish those 4 last days of quarantine?
It's very important to finish that full 14-day quarantine. What we do know is it can take up till day 14 for you to start to develop any symptoms of COVID-19. If you are not feeling any symptoms at day 10, 11, 12, 13 and go out of quarantine, you could potentially still develop symptoms, still have the virus and spread it to others. That's also why it's important not to rely simply on a test that's performed before day 14. Getting a negative test prior to the full 14-day quarantine is not a get-out-of-jail-free card for you to get out of quarantine. The test tells us that you do not have COVID-19 at that moment. It still could take up to the full 14 days for it to develop in your system.
So say I was exposed yesterday to a positive case. I get the call from the health department or the contact tracer and say, hey, you've been exposed to a positive case. Do I run out and get a test right away? Do I wait a few days? What should I do?
It's important to wait because you don't have symptoms right now, and you might get a false negative test result, meaning that your test comes back negative, but it's actually false because you do have the virus. It's just too early for us to detect it. It can take several days for that test to be able to detect the virus, and depending on what test exactly you get run, it can be several days from the initial contact.
You mentioned false negatives. That doesn't mean it's inaccurate or wrong. It means
simply that at that point in time, when we take that snapshot, that your body has not developed COVID-19 to a detectable level for the test yet.
Since you mentioned testing, how do I go about getting a test?
There are several ways to get a test, and thankfully, testing is more widely available than it was several months ago. Here at Scheurer, simply seeing one of our providers enables you to get an order for a test, at which point they could either, based on the test ordered, test you right there in the office or clinic or emergency department, or else they could send you to a centralized testing site at the hospital. That would vary based upon the date, time, and location that you visit.
So at Scheurer Health, I just can't pull up, drive in, and say, hey, I want to test?
Correct. It's important that you're evaluated by a provider because simply getting a test does not necessarily provide much value if not put in the context of why you need one.
Now, what about the walk-in clinic?
Yes, so the walk-in clinic is a place that you can get tested at. However, it is important, as always, that you see a provider then as well, and they will help determine whether a test is appropriate. If you were exposed earlier in the day, found out you were exposed and show up, it is still too early for a test to be effective, and therefore the provider may not feel that it is appropriate to do a test at that time.
Since March, we've seen varying times of getting those test results back, actually. Whether it's the PCR, the rapid test, or whatever test it is.
There are different types of tests that we are able to perform, and each one of those tests does have different periods of time that it takes to get the result back. Here at Scheurer, we're able to perform a rapid test that can be run with the results given to you at the same day or potentially same appointment. That test is what we call rapid test and is not the gold standard test. However, it does give us a quick answer. The gold standard test, commonly referred to in the public as the PCR test, is a test that needs to be sent out to a lab to be processed. That varies significantly based on the amount of testing that's occurring. Early in March, the testing was not widely able to be performed at different labs, and therefore it was long periods of time for it to come back. Since then, it's become more widely performed at different labs, and different supplies are making it quicker to get the results back. Sometimes it's anywhere from 24 to 48 hours. However, as testing amounts have increased, labs have become stressed once again with the sudden resurgence over the last several weeks. It's now taken upwards of 5 to 7 days for us to get that gold standard test result back, which is why it's important that we have that rapid test often to have an answer right then and there. It also is not uncommon here at Scheurer for us to perform both of those tests, so we have an answer immediately, which is valuable if it's positive. If it's positive, we know for certain you are positive. If it's negative, once again, it's not a get out of jail free card. It simply tells us we cannot make sure that you are positive at this time.
A little bit of a hot topic here, but what about masks? Do they work? What are the benefits? What's your take on it?
Masks have been effective and have been shown to be effective in helping reduce the spread of COVID-19. What we do know is COVID-19 is spread through the air we are breathing. Whether it is droplet or airborne is a fine scientific detail that is still up for debate. However, what we do know is that it is spread through the air we breathe. This is the most common way that people spread and contract it. By wearing a mask, both yourself and other people are more protected. If both people are wearing masks, the air we are breathing is filtered in essence twice, which provides more benefit in terms of preventing the spread. Therefore, it's important for people both to wear to protect themselves and others. There have been some small studies performed throughout COVID-19 that have shown that masks have reduced the spread of COVID-19 from one person to another.
So say I start showing symptoms of COVID. Do I stay at home in bed? Do I get additional care? Do I go to the emergency room? What are the steps I should take?
COVID-19 is a virus, and much like other viral illnesses, there aren't any magic antibiotics that will kill a virus. There are some medicines that have been shown to potentially help COVID-19 for people with moderate to severe symptoms. These have had emergency use authorizations by the FDA that approves medicine in America. Some of these have had follow-up studies that have shown that they may not be as effective as they initially thought. Therefore, their use may seem to vary a little bit, location to location, provider to provider. With that being said, it's important to seek medical attention if you are struggling to breathe from COVID-19. What we are able to do is provide support to help you breathe, although we do not have any medication that will magically make it go away. What we do know, however, is minor symptoms are simply things that need to be treated at home with supportive care. This is making sure you're getting plenty of sleep, plenty of rest, and drinking plenty of fluids and keeping your health up.
You mentioned the FDA, so let's talk about vaccines for a moment. We seem to be making great progress on vaccines, but what does that timeline look like?
So the Food and Drug Administration has a very rigorous process for approving vaccines. You may have heard about Operation Warp Speed, sponsored by the federal government, which is intended to help speed the research process to produce vaccines. It is not necessarily shortcutting the FDA approval process. That is still a very stringent process that the FDA is not willing to shortcut. As part of that, there are phase 1, 2, and 3 trials that need to be undertaken for any vaccine. They are currently wrapping up phase 3 studies of COVID-19 vaccines. Once these are completed, it's anticipated that some of the vaccines in development will have emergency use authorization by the FDA for use in the public. Once this happens, the federal government has a very pre-planned playbook as to how these vaccines will be rolled out. Most importantly, they're looking at who's most at risk. Those are frontline healthcare workers and other frontline workers that are exposed to the virus and simply don't have an option to stay home and stay away from the virus. Also included in this first round of vaccination would be people living in those nursing homes, as we know that nursing homes were hit very hard by COVID-19 back in the spring. As we look forward, vaccinations for the public as a whole generally will occur sometime in March, April, or the spring of 2021. Timelines still are not decided yet, and it's important that everyone gets the full 2 doses that will be required for these vaccines. If people only get 1 vaccination dose, it defeats the purpose of getting vaccinated.
And when you say both doses, you mean it's a 2-step process taking place on 2 separate days in order to get the entire vaccine?
Yes. In the past, people probably recall getting boosters of certain vaccinations. This is exactly what it is, only a short time frame when you get your booster vaccine. It still requires time, such as 2 weeks generally, for a vaccine to be fully effective in your system. It will still be important after you're vaccinated to continue to carry out with proper precautionary measures to protect yourself and others those first few weeks after you're vaccinated.
There's a lot of conspiracies out there about those shortcuts that you were talking about. Are you willing to get the vaccine?
I absolutely am willing to get the vaccine and plan to get the vaccine. While this may be a new vaccine, vaccines have been around for years. People continue to go out every year and buy the new model of a Chevy Silverado, but the Silverado has been around for years. They don't think twice about getting the new model. It's simply a different version of something that's been around. In the history of the world, herd immunity has never occurred without the aid of a vaccine. Therefore, vaccines hold significant importance in us returning back towards a new normal in our society.
So let's talk more topically as of what's happening right now in the United States. We're seeing more positive cases. We're seeing that curve go back up. What ramification does that have on our health systems?
The difficulty with the health systems in terms of dealing with this is not just the amount of beds available in hospitals to care for these very sick patients, but also the amount of staff that are healthy enough to continue to take care of these patients without spreading it themselves. While many people don't necessarily have significant symptoms, what you don't want to be is one of those people who develop severe symptoms. It's difficult for us to predict exactly who that would be. We've seen in many young adults even, people develop symptoms that require hospitalization and even being placed on a ventilator.
So say, as in the case of a lot of our larger tertiary hospitals in Michigan, they're nearing capacity. What effect does that have on the entire health system?
So these tertiary centers that are caring for many of the severe COVID-19 cases in their large ICUs are also the places that are designed to care for many of the strokes, heart attacks, and other diseases that occur on a regular basis. If close by tertiary facilities are full, they'd need to go further away, and that time could cost them extra brain in the case of a stroke, or extra amount of their heart muscle in the case of a heart attack. It's important that we keep this under control so that we're able to have capacity for these other diseases.
And if I'm being frank, it's quite impressive to see the plans that have been put in place that in the event that those situations do occur, Scheurer Health and other local hospitals are ready.
Absolutely. We've spent significant amount of time, energy, and effort to make sure we have everything in place to continue to care for patients in our community. There's nothing that we couldn't care for before that we can't care for now. However, it's the larger tertiary facilities that are significantly strained by COVID-19. We're working hard to ensure that everything our community needs is still taken care of.
To wrap things up here, if there was one thing that you could tell our viewers here today, what would it be?
Continue to take precautions. Be alert, not anxious. Be sure you're continuing to wear your mask when you're out in public, as well as other members outside of your household. While at home, you don't need to wear a mask. However, it is important when you go to work or other places that you wear a mask, including when you're doing things such as eating lunch around other people not in your household. That's a common area where we're finding that people are struggling, is taking breaks and doing other things at the workplace where they may take their mask off, such as eating. It's important that you continue to maintain space between you and your coworkers so that you don't contract and spread the disease unknowingly.
Well, Dr. Ramsey, thank you for being here. I think it's great to clear the air, and it should be a great benefit for our community.
I'm glad that I could be here and hope that I was able to help share some scientific knowledge and some medical knowledge to help people get through COVID-19 better.
As always, for the latest information, better health begins at Scheurer.org. Sure. Better health, better life. Are you sure?